Let's go ahead and get started. Welcome to this session of the 2024 Culture of Data Conference. Thanks for joining us. I'm Allison Rosenthal. I use she, her pronouns, and I will be moderating today. We also have Lala Kaiser here, who's going to be tech hosting. Her pronouns are she, her. Um, if you have any issues throughout the session, feel free to privately message Lala. You are all muted now, but if you have any questions during the Q&A session, please feel free to unmute. You can also use the chat box to write in questions. If you are comfortable doing so, please change your Zoom name and add your pronouns by clicking the three dots on the video square and selecting rename. So we have one presentation during this session. It's going to take approximately 25 minutes and there will be 10 minutes for Q&A. And I am very excited to hear this presentation. This is from my colleague, Alyssa Dalen, and they do a lot of great work integrating equity and public health into crime victim services. And it's just really great that this topic is a part of this conference, and just acknowledging that public health is very broad and public health is everywhere. So with that, I will turn it to Alyssa Dalen to present using data to make equitable funding decisions for crime victim service programs in Colorado.
Thanks, Allison. I'm going to share my screen. Just get my slides set up here. Hi, everyone. My name is Alyssa Dalen. I use they, them pronouns, and I am a statistical analyst with the Colorado Department of Public Safety in the Division of Criminal Justice. Today, I'm really excited to be here and have the opportunity to speak with you all about some of mine and my team's efforts to use data to guide equitable funding decisions in support of crime victim services in Colorado. So I just wanted to briefly touch on the different elements that I'll be presenting on today. So I'll start off by providing some background context and then move into some of our current program activities. And I intentionally use the word current here. I think it's helpful context for you all to know that a lot of these activities are ongoing. So we are actively looking at different ways to work on this project, and we're open to any insights and discussion that comes up from conversations like this. And then I'll close up the presentation today with future goals and next steps. So jumping right in, as I mentioned, I am a statistical analyst that works in the Colorado Department of Public Safety. And one of the teams that I support is the Office for Victims Programs, or OVP. And OVP houses a number of programs to support victims of crime throughout Colorado. And these programs include things like supporting local victim compensation and bail programs, victim rights compliance, statewide anti-human trafficking efforts, supporting statewide responses to sexual assaults, and administering grant funding for victim service agencies, which I'll talk more about next. So the Office for Victim Programs currently awards victim service programs throughout Colorado with grant funding, both from federal grants as well as from state funding sources. And the OVP team works very closely with the Crime Victim Services, or CVS, Advisory Board. So this is a 28-member board that's appointed by the Department of Public Safety's executive director. And the goal of this board is to bring together diverse voices from a variety of community and professional stakeholders. So to give you an idea, some of the positions on the board include culturally specific organization representatives, community members, experts in the field of victim services in the state, victims of crime themselves, and other related stakeholders. And so this advisory board works to provide funding recommendations for OVP on how to disseminate crime victim service funding throughout the state of Colorado. And I also wanted to include on this slide the current OVP funding philosophy. And this is shared with all programs before they apply for grant funding, so that they have an idea of this funding philosophy. And the funding philosophy of the CVS board and OVP is to distribute state and federal grant funding across all judicial districts in Colorado through an accessible, equitable, criteria-based process that involves statewide multidisciplinary reviewers, victims and survivors of crime, and representatives of communities impacted by inequity, as well as honoring the state and federal requirements and the intended uses for the funds. So the process that OVP and the CVS Advisory Board currently uses to award grant funding is a competitive review process. So for those that might not be as familiar with grant funding, this review process works by having a set of reviewers that go through each application for grant funding and rank those applications based on predetermined review criteria and how well that program aligns with the criteria and values of the funding organization. So applications are ranked by CVS Advisory Board members based on these review criteria and funding philosophy in order to make the funding decisions. And to give some additional context on the funding that OVP administers, I wanted to talk a bit about trends in federal crime victim service funding. So one of the largest funding sources that the Office for Victim Programs administers is from the Federal Victims of Crime Act award. And this is an award that's been established since 1984. So this is a longstanding funding source that we've received. But the values of funding that we receive each year have quite a lot of variation. So you can see from this chart that in 2018, there was a substantial peak in the VOCA funding awarded to Colorado. And after 2018, we've seen steady decreases with the exception of 2021 to 2022. But what I really want to draw your attention to is the decrease that we're seeing this current year. So from between 2023 and 2024, unfortunately, we're expecting and we have received a 42% cut in funding. And as the chart shows, we've been experiencing decreases over time, but I'll also mention that during the years where 2020, 2021, and 2022, when the COVID pandemic was occurring, there was some additional funding available through the American Rescue Plan Act that was able to offset some of these decreases. But that means that this is the first year that we're really going to be feeling the impact of this 42% cut in victim service funding. So that's really some of the background context to why this work is so essential right now. Thinking about funding decisions when there are very limited resources available leads to some challenging questions, and that's what I'm here to talk about today. So when I first joined the Office for Victim Programs team, I joined a project that this team has been working on and was asked to support the overarching research question of how OVP can best utilize available data sources to guide future funding decisions that center equity for victim services in the state amidst these substantial funding cuts. No pressure, right? Not an easy question to tackle, but I was very excited to join this team and begin to work on some of the kind of complex layers around this question. And I'm excited to share some of these things with you all today as well. So why is equity so essential, especially in the field of crime victim services? The reason why we need to center equity in these conversations is because violent crime impacts some communities much more than others. So we know that from 2017 until 2019, approximately 45 out of every 1,000 Coloradans reported experiencing violent crime. And as I mentioned, not all communities are impacted by violence at similar rates. An analysis of the National Crime Victimization Survey, which is a nationally representative household survey that's conducted each year, found that Black individuals experience 1.5 to 2 times greater risk of violence than whites, and Hispanics are at 1.2 to 1.5 times greater risk of violence than whites. We also know that risk for violence is also greater for male individuals, those that are younger, and also those that live in poorer households. So as I was thinking about this overarching research question of utilizing data to support decision-making, I was thinking about what other relevant data sources we have available. And so some of the main quantitative data sources that are available in the field of crime victim services are including things like crime data. So data that is reported by law enforcement agencies about the crimes that are occurring in their jurisdiction. And in Colorado, we have access to crime data from law enforcement agencies through the NIBRS reporting program, the National Incident-Based Reporting System. Some of the other data that we have available includes administrative data from the Office for Victim Programs. So the data that programs that are funded through our grants are required to report, things that the federal funding sources require from programs to report. We have that data available as well. And then I also wanted to mention the National Census of Victim Service Providers, as well as I mentioned before, the National Crime Victimization Survey. So these are surveys that are conducted at the national level. The National Crime Victimization Survey has just recently been conducted at a statewide level for some of the larger states, including Colorado. But these surveys are also important quantitative data that can help us understand trends in self-reported victimization, as well as the number and types of victim service providers that are currently operating. However, these quantitative data alone do not tell the whole story. And that is partially because of some of the limitations that are inherently involved within these quantitative data sources. So when you think about crime data, one of the big caveats to crime data is that there is a substantial amount of crime that is not reported to law enforcement agencies. And this is not represented in the crime data that we have access to. As well, when we're thinking about administrative or grant reporting data, these data are limited to the programs that are grant funded. And oftentimes, organizations are asked to prorate the data that they report. In other words, they're asked to only report data about the portions of their organization's activities that are directly funded by grant programs. So if you're thinking about having a larger understanding of, for example, how many individuals are served by victim service agencies in Colorado, using this grant reporting data would only provide you a portion of that information. And then when we think about some of the surveys, they offer a wealth of information, and they have the benefit of being able to capture some of the incidents that may not have been reported to law enforcement agencies. However, they also have limitations. So the national surveys are conducted in a way that they're representative of the national population. And with the NCVS, or the National Crime Victimization Survey, the recent move to looking at statewide estimates means that there are surveys being conducted that are sampled to be representative of Colorado as the whole, so as the whole state, which gets us closer. But we don't have the ability to parse out any trends within different regions in Colorado. And we know that Colorado is a very diverse state. We have a lot of different regions that have varied characteristics of populations and community makeups. And we know that crime isn't occurring the same way throughout those communities, especially given the disparities that I mentioned previously. So without a more granular survey approach, these estimates can't get us as nuanced information about the different regions in Colorado as might be helpful, especially when we're thinking about making funding decisions. Another limitation to survey data, including the National Crime Victimization Survey, is that there are sometimes smaller sampling sizes for specific racial and ethnic communities that make it less valid and less reliable to look at trends in these communities or disaggregate the data so that we can understand more about these communities. And so that's a limitation that we also have to be aware of. So all of that being said, the main takeaway here is that we can't rely just on quantitative data in order to make funding decisions. We also need to look at where there are gaps in our data and try to fill those gaps with methods of engaging with communities and understanding better what is happening and how we can support victims of crime the best that we can throughout Colorado. Another step that I took when I have been working on this project is to look at available literature on grant-making strategies, specifically in the crime victim services field, and specifically thinking about grant-making strategies that are centering equity. And when I was doing this literature search, the majority of the research that I found that had this equity lens focused on methods of reducing administrative burden within grants administration. So things like reducing the requirements of data reporting and making it as easy as possible for smaller organizations or programs that might be newer to access and successfully manage a grant fund. The other types of steps that research highlighted on promoting equity and grant making was about streamlining the application process. So making it as easy as possible for applicants to access the application and to complete that application, and providing flexible funding. So things like avoiding reimbursement only models where organizations are required to have funds up front to pay for purchases and expenses and then be reimbursed by grant funding, as opposed to having access to that grant funding up front to make those purchases. And so these types of steps are really important, and they didn't include information specifically to how to make the funding decisions of which grant applications are receiving funding and how to think strategically about distributing funds throughout an area. Actually, very few sources discussed actually making the funding decisions. And those that did highlighted above and beyond community involvement throughout all stages of the decision-making process. But part of this presentation that I wanted to emphasize is the gap in the literature, that there was no available literature that was specific to funding decisions within the field of crime victim services. And this is a huge field, and we have a lot of complex information at our hands. And this is something that I think is, it's a very substantial gap that I would hope needs to be filled. So this is my call to action for anyone maybe planting a seed in this room, if anyone happens to be interested in conducting research and kind of bridging this gap between academic research around decision-making and equity and crime victim services over into the practice of actually funding federal funds out to state programs that are providing essential victim services. And so next, I wanted to transition into talking a bit about some of the Office for Victim Programs activities that are related to this conversation around equity and decision-making. So the Office for Victim Programs has decided to implement a one-year extension in the face of these substantial federal budget cuts. This one-year extension of awards is being chosen instead of starting a brand new traditional grant cycle, which is a 2-year cycle is what we've traditionally operated on. So instead of opening up applications to have programs reapply and have new programs apply for funding and going through this application review process, OVP opted to implement this one-year extension of awards instead. And the reason that we've decided to do this is to avoid the administrative burden of programs needing to reapply for funding, as well as allow us some time to advocate for additional funding to fill this funding deficit gap. And this is also a benefit of this one-year extension, is that we don't have to stretch the current funds over a 2-year cycle. We are able to use these funds for a 1-year application cycle and have some time to figure out some methods of gaining some additional funding to look at funding future application cycles in a more strategic manner. The other piece that OVP has opted to do after hearing from programs and listening to what programs needed from us in this challenging time was, in this one-year extension, allowing for programs to have open or flexible budgets. So this means instead of OVP dictating which types of expenses are allowed for programs and where they needed to spend the money that we are awarding them, OVP has opted to allow for programs to decide where this money is most needed and to be able to spend that money accordingly. And another goal that we had in more of the short term was to gain a better understanding of the impacts that these budget cuts would have to CVS funded programs before making decisions regarding the award amounts for the one-year extension. And some of the context here as well, we had a very limited timeline to work with in making these decisions, and also a lack of available resources. And so for this reason, we chose to do a survey. I think there are there's some other methods, things like focus groups or direct outreach and conversations with programs that in an ideal world with unlimited time and resources may have been a more ideal choice for us. But given the circumstances that we had and considering that we didn't want to further burden programs' time and capacity, we chose to conduct a survey with our programs to better understand these impacts. So this survey was disseminated between September and December of 2023, as I mentioned, to all of our funded programs. And we received an overwhelmingly high response rate. We were very pleased to see that we had received 174 responses, which is a 78% response rate. So we heard from the vast majority of programs about these questions that we had asked. I wanted to provide some of the questions that we asked in this survey. And these questions were based on an example that we had done some outreach with some of the other partner organizations that we work with. And one of these partner organizations had conducted a similar survey when they had been receiving funding cuts to one of their programs. And they felt that this was a successful method. These survey questions worked well for them to better understand some of the impacts of these budget cuts, as well as get a sense of what types of needs as far as the funding amounts that their programs required to continue being implemented. So we modeled this survey after that example, and we asked programs to share with us what amount of money at the very minimum they would need to be awarded in a one-year extension to implement their program, what elements of their programming they would prioritize maintaining, and what elements of programming they would need to let go, as well as how they would continue to prioritize the needs of communities impacted by inequity, which is one of our key funding priorities, and what types of activities they would add back in if they were to receive additional funding. And from this survey, we received a variety of results. These survey results really told a powerful and oftentimes a disheartening story about the true impacts of limited funds in crime victim services. One of the main takeaways from this survey that wasn't unexpected for us was that programs really needed more funding than we have available to provide during this one-year extension. And so that means we will unfortunately have some very difficult situations for programs to navigate where they will not be able to receive as much money as they would need. And sometimes programs may have to make some really tough, challenging decisions about how to navigate that. We also learned from programs in this survey that there was a wide-ranging impact of elements that they would need to cut from their program. Programs emphasized that they would need to cut staff positions and salaries, the types of services that they're able to provide to victims and survivors of crime, emergency financial assistance to victims and survivors, as well as the number and types of clients that they would be able to serve. And these results were presented to the CVS Advisory Board to inform conversations about the one-year extension funding decisions. Unfortunately, today I can't share any of the specific outcomes of this conversation, as we're still in the process of preparing to inform programs about their funding information and awards. And we're prioritizing being really transparent with our programs. So we're making sure to get that information out to those programs before sharing it more widely. However, for the purpose of this presentation, I did want to discuss some of the limitations that we had with this survey. Programs really may not have felt as comfortable. Some programs may not have felt comfortable disclosing some of these details due to the known power dynamic that we have asking for this information as the individuals that are administering the funding decisions. We also know that the survey platform may have lacked this ability for more richer dialogue with programs. And some of the additional challenges that we faced was really a lack of consensus, both in the survey results, which we expected, as well as within the board conversations around what steps to take with these survey results, and specifically with the one-year extension decisions. And then as I'm wrapping up here, I also wanted to just briefly highlight another project that we worked on, thinking about advocating for additional funding in this area. We were able to analyze grant reporting data to create some county-specific fact sheets, emphasizing the impact that programs have in their communities and the importance that they have. And so I do have a link to this if you access the presentation materials, and we have one of these for each county. This is the example on the screen from Adams County. And then our future steps going forward within OVP, we're really going to work in partnership with the CVS Advisory Board to look really hard at these application review criteria and strategies that we're currently utilizing to review grant applications. And our commitment is to conduct community outreach, soliciting feedback on these review criteria before making funding decisions for the next application cycles, as well as continuing to identify additional data sources and identifying best practices for incorporating data into work. So things like outreach with other professionals in the field and other states that may have insight into best steps forward. And that is what I have to share with you all today. That's the end of my presentation. So I am more than happy to take any questions that you might have at this time. Thank you all.
Thank you, Alyssa. Really loved all of the background. Looks like we have a comment in the chat to put the link of the county reports so that people can distribute them and share them with relevant people. So we will work on that. Yeah, as people are thinking about questions, I just had one question for you, Alyssa. I know as part of your literature review and information gathering, you also process, you also like talk to other states about how they were dealing with the a funding crisis, and just wondering if you could share any reflections from what you learned from other states.
Yeah, absolutely. So we did have the opportunity to connect with multiple partners from other states that have been facing the same challenges with these federal budget shortfalls. And what I think my reflections would be on some of those conversations is that we share a lot of the same concerns and are working to do our best in a lot of states to make funding decisions without sometimes all of the data that we would love to have access to, and all of the information that sometimes feels like it would be the most beneficial in order to make those decisions. So I think the field as a whole is working both in parallel and trying to connect with each other to try to navigate the best steps forward. Every state is a little different, but in general, I would say there's a lot of shared common challenges to navigate right now.
Thanks. And Nicole, if you'd like to ask your question.
Yeah, thanks. Uh, Thank you so much for this presentation, Alyssa. There are a lot of parallels to some work that my team is doing. I work for the for CDPHE, the State Health Department, and I just wanted to give a plug about that. That like I have some specific questions that are very nuanced and detailed about like some of the similar things that we're doing. So if you'd like to connect, I'd love to do that. And one of those in particular is about what we're doing to think about how we make funding decisions, and using information that might be in applications from someone, right, about like what's the population served and things. So yeah, and then shameless plug that we're talking a little bit about this at 12:30. Not that part so much, but the former part where you were saying there's a lot of research around equitable administrative processes, and that I just wanted to highlight that those equitable administrative processes are important and go a long way. And you need to be thinking about how you're making your funding decisions as well. Just making it easier to do the reporting isn't sufficient if you're not being equitable in how you're deciding who gets those funds. So thanks so much for the work that you're doing. And it's really great to hear that other state agencies are thinking about similar things.
Yeah, thank you so much, Nicole. I'm putting my email into the chat. I would love to connect. I definitely resonate. I think we're feeling similarly. The research is helpful in some ways and limited in a lot of ways as well around getting at how to make those decisions in the first place.
Oh, Ellen, yeah, please feel free to ask your question.
Hi, good morning. Thank you, Alyssa, for the presentation. I'm Ellen Graham. I'm with the Latino Coalition for Community Leadership. So good to see our name on the fact sheet. And we are, so you all know, we're a intermediary, a grant intermediary. So we receive state and federal funds and then grant them out to community-based organizations. And I think both Nicole and Alyssa, what you're talking about is of primary interest to us, because even though we do grant out to small organizations, there is a dearth of literature about it. And I really liked what you had in your presentation, Alyssa, about moving away from cost reimbursement models. You know, we have an advance possibility. We are a lot of our grants, including the victim services grants we currently have, are cost reimbursement, but we allow it an advance, which helps somewhat. But one thing I wanted to maybe throw out there is, did you look at, because I know one thing that as an intermediary, we are able to take on community partners that might be considered too high risk on their own. We can kind of be a buffer between the funder and the community partner. And I wondered if that's something that you could speak a little bit more about, or maybe what you've discovered as far as looking at that risk assessment. And I'm sorry for using that term. It's an insurance term, but thank you.
Yeah, thank you, Ellen. That's a really great point that you bring up. And I think one of the things that we have talked a lot about as a staff is that how to evaluate an organization's capacity for grant funding, and which of those and how those intersect with this conversation around equity, and is there a way to balance? I think sometimes the challenge that we face as a staff is that we have limited resources and capacity as well as a staff to support some of the administrative processes that are required from grant funding. And so balancing the limited resources that we have as a staff with the idea that, you know, there needs to be opportunities for programs to learn and the opportunity to build some of that capacity. So I can't necessarily speak on any solutions at this point, but I do know that these are ongoing conversations, and we're really considering how to find that balance and how to think about those things. So thanks, Ellen.
Oh, thanks. And Nicole wanted to put a plug in for a session that that she is doing at 12:30, talking about advanced planning, advanced payment rather than solely reimbursement and higher risk entities. So it sounds like there's a lot of synergy. So that's very cool. Nicole, if you'd like to ask your question.
I just want to highlight this point that Alyssa, you're making about the technical assistance that's required to work with organizations that are doing really great on the ground work and maybe are considered higher risk. And just because they haven't done it before, it doesn't mean they're not capable, right? And just highlighting that you're not the only team experiencing some of those challenges. So yeah, not alone.
Thank you, Nicole. I also saw your session after mine, and I thought that that was a happy coincidence, and I'm very excited to attend and hear more.
Oh, great, thanks. And Rebecca, if you'd like to come off mute.
Yes, thank you so much for your presentation. I work with immigrants, some of who are undocumented, and obviously they would most likely fall in the category of not reporting any violent crime. I'm wondering what kind of effort there might be to reach those people that are very unlikely to report violent crime in your data collection.
Yeah, that's a great question. I can't speak specifically. I know that we have programs within Colorado that are working to provide outreach and victim services to specific populations, including folks that work directly with immigrants in those populations. However, at the moment, unfortunately, we don't have a great way to collect data specifically about those populations and the outreach that's occurring, unless those are individuals that are being served directly by the programs. So there isn't, I would say the limitation is around understanding maybe some of those broader outreach, how many individuals might be reached with some broader advocacy materials or outreach or other ways that programs are connecting with communities, unless those individuals are also receiving direct services individually, then they may be captured in the data that we're receiving in the grant reporting data. We have some categories that programs can check around special populations, and immigrants and refugee populations is one of those categories. But we also find that sometimes individuals feel more comfortable not disclosing that information, and that's also a fair and valid concern that they have. So I don't think that we have right now the data that you're talking about or the ability to collect that, unfortunately, right now.
Thank you. Yeah, I think sometimes people are fearful also to disclose because they are afraid that it might work against their efforts to gain status, unfortunately.
Yeah. Absolutely.
Oh yeah, I guess I can ask another question, Alyssa. Yeah, I was wondering if you could talk a little bit more about your program's relationship with the board and and how how they've been helping you with making these decisions and like what perspectives they provide.
Yeah, absolutely. So we work very closely with our board to have these conversations. We don't make any funding decisions without having a board meeting and presenting information to the board members and kind of bringing them up to speed on some of the background context and some of the background analyses that we have worked on. And our board really is the key entity that is making the recommendations for us. There's been a lot of work in previous years to increase the diversity of voices that are represented on the board, and that's still ongoing work. But our goal with the CVS Advisory Board is to bring in perspectives, especially from communities that have been underrepresented in the past and have been underfunded in the past when it comes to crime victim services, and to have those voices be part of the decision making. So I just also wanted to highlight that process as something that's ongoing. I think that's a little bit more about the relationship. We also have some subcommittees that are a part of the board. So we'll be working very closely with a subcommittee of board members that will be kind of doing a deeper dive into the application materials and the review criteria for upcoming application cycles. So board members are able to volunteer for those subcommittees as well. To spend their time if they're interested in doing that piece.
Thank you. All right, we have no other questions from the audience. I'll do some closeout announcements. Thank you all so much for attending this session and for engaging in our Q&A. If you would like to view the presentation and slides, they are available on Sched. And we're also going to be, the committee for the culture of data is going to send out a survey for you all to participate in. This feedback is really helpful for our planning for next year's conferences. And and then we also have a raffle for people to win two $50 gift cards. Yeah, one of two. And then we're going to have a break now for lunch. And during that time, you have the opportunity to listen to a walk and learn session. These are audio only sessions like a podcast. And the one that's featured in this next time slot is promoting health equity through program evaluation partnerships. So very thematic to this topic today. The next live session will begin at 12:30 and is another concurrent breakout. And if you want to see the full schedule, you can go to Sched. Yeah, thank you so much again, Alyssa, for your presentation. It was very informative, and I loved hearing the Q&A today. I think there are a lot of partnerships in progress that are going to be possible because of this presentation. So thank you all again, and hope you enjoy the rest of the conference.